Dr. Joe Cangini, Akron Children's Hospital Sports Medicine Center, now joining us live for his visit with us on Wednesday. And Joe, the Olympic Games in full gear right now.
And it's very intriguing to me. It's one of the things I love about sports, to see how people handle, some of the pressures. And I find myself really watching, and a few things that really have been discussed quite a bit in the last 48 hours. Number one, I think you probably heard this morning and mentioned that Simone Biles withdrew to focus on her mental health, and some of the issues she's having are not physical health issues, but more mental health issues. And there's been an awful lot of talk at these Olympics about the issue of sports psychology. You and I have talked about that even in the last year, and we worked really hard at Akron Children's in the last over a year or so to develop a pediatric sports psychology division. And oh my gosh, Ray, it's just making exponential leaps. Our sports psychology division is growing so much down at our office. It's run by Dr. Allison Weldon, and she's doing a great job, very busy. Like everything else, I mean, pediatric athletes have other issues and stressors than professional athletes and college athletes. So it's kind of unique, but it's growing a lot. But one of the things is an area that's called mental performance training. And so there's a lot of talk, Ray, about train your mind as well as your body to be the best performance-wise that you can be. And these sports psychologists work on different things. I don't want to sound like I can oversimplify it this morning in a brief presentation about it, but they work on, with young athletes, things like positive mental imagery, to be thinking in a positive mindset, visualization of good things happening and not bad things happening when you're competing. There's a lot of self-talk, and I see even a lot of adult athletes, if you see in the pro golf tournaments and other things, a lot of positive self-talk as athletes talk their way through this. And the other thing is that athletes really like to keep their routines. You see them do the same thing all the time as they train for 4 years, 5 years for this one night, for a minute and a half event. It's really a lot of pressure, and they seem to, some handle it good and others struggle with it. And the sports psychologists really help in training your mind as well as your body. And then avoiding the mental blocks that, there's a lot of talk about safety mental blocks. Embrace them, master your emotions when you're in the moment of competition. And those are just a few of the things that the sports psychologists do a lot of teaching. And of course, our young athletes and our local athletes face a lot of the same things, and they have a lot of other issues related to anxiety and other things, and depression and post-concussion syndrome. And so our sports psychology has been very important. And in this Olympics, you've seen the mental performance training definitely be something that's affected a lot of the young athletes. And so I did want to mention that. And one other thing that's really come up a lot, and a lot of people are asking me questions about, I think it was partly the Michael Phelps interview the other night, as he's been on quite a bit, and what an incredible athlete he is. He talked about the use of lactate levels, blood lactate. And so a lot of people are saying, what the heck is blood lactate levels? What are people using that for? And a lot of higher level athletes use blood lactate levels to monitor their training. Lactate is a byproduct. It's kind of a marker of muscle fatigue. And so what happens as you train, you can postpone or improve your threshold of blood lactate, but there is a point where the lactate starts to accumulate in the muscles faster than you can get rid of it, and all of a sudden performance is going to drop. And I really wasn't even aware that a lot of high-level athletes, even strategically during their competition, between games, between races, between competitive events, they test their blood lactate levels and use it strategically to try to make decisions about what they're going to do in their next competition. I know there was a lot of talk about Katie Ledecky, the swimmer, because she had a short distance event, which are really called anaerobic events, followed by a long-distance aerobic event, and that she was going to have to make some strategic decisions about how to face that. And so one of the things that came out in a study is that if you're playing multiple games, multiple races in a day, it's better to have active recovery than passive recovery. So what that means is you'll see these athletes, if it's like 40 minutes or a half an hour between events, even an hour, is they keep moving during that period of time. It's better to have light intensity skipping or walking or stretching rather than just sitting down. And so we see that, you see the NBA players go to the end of the bench and ride the exercise bike or things like that. That's been kind of a newer thing looking at it. But anyway, the marker that many of these athletes use, and it's kind of coming down to the high school level athletes that I see as well asking about it, especially the endurance athletes, our runners and so forth, is lactate levels, blood lactate levels. So two things I've learned a lot about is the sports psychology component, the mental training, and the lactate levels. And I'm happy to say that we have both at Akron Children's Hospital for pediatric athletes that are really interested in doing the best with their training that they can.
Excellent stuff, Joe, and really hitting the nail on the head. It seems like the mental aspect with sports, whether it be anxiety or stress, and that is as big sometimes as the physical aspect as well when we talk about sports medicine. Thanks for the visit, my friend. Always appreciate it.
Thanks, Ray. Have a great week. Enjoy this great weather.
Most certainly. Dr. Joe Congini, Akron Children's Hospital Sports Medicine Center with us.